Welcome to Chakshu Foundation. My name is Pavan M Srivatsa. I'm the founder of Chakshu Foundation and I'm a consulting psychologist. In today's Ask the Therapist series, there is a wonderful question, and the question is, why do I need a therapist when there are so many self-help books? It is a very valid question, and I would like to give you an answer in two parts. The first part is to address about how self-help books are written and how it helps the people, and on the other side I will be explaining to you people about how a therapist will help the person with the same problems. For instance, we shall take an example of self-help books that are focused towards the people who are having performance anxiety. When you read these kind of books, you will come across the examples of people who are having performance anxiety, and it will talk about you are not the only one who is facing these kind of situations, and then they will be giving you tips and tactics and techniques as to how to deal with the problem situation. They clearly explain you as to what to do before the performance, during the performance, and after the performance for specific things like exam, the stage performance when it comes to a PowerPoint presentation in your meeting and things like that, when you're on the hot seat, or when you're giving an interview, how do you handle the pressure when you're sitting on the hot seat and things like that. And this kind of self-help books will be focused towards a collective sample of people who are facing same kind of issues, which we call as similar issues, and it will be addressing the people in a mass because they want to satisfy the majority of the population who are facing the same kind of problems. In this instance, it is performance anxiety. When it comes to a psychologist, the way we handle it is a little different from how the self-help books address. First things first, when it comes to a therapist, we first try to understand the person sitting in front of us, who the person is. The second thing we understand is what is the problem this person is facing. The third thing we understand is why is this problem in this person. The fourth thing we understand is, we try to analyze with these understanding is, where is the root cause of this problem. The next thing we understand is through the 3P model, which we use in counseling, especially a few therapists use this. The first thing is the predisposing factors. What are the qualities this person has in his personality, as a result of which this problem is staying in this person. Is there any genetic cause, or is there any biological cause, is there any psychological cause, or is there any social cause, maybe bullying or things like that, or sexual abuse, or the violence that they have experienced in their house or outside of the house, in the society, in the locality, in their religion or in their culture. Is it that is contributing to the problem? The second thing is precipitating factor, which is the most important part we focus on, which is the triggering factor. Why is this problem triggered in that person in this way? And the third thing is, the third P in the 3P model is the perpetuating factor, which is how is this person handling the situation? Is this person having any deficits, or how is his coping strategies? Is he having the coping strategies, or is he using unhealthy coping strategies, as a result of which the person is continuing to stay in the problem rather than coming out? So we understand the person from these three dimensions, and we go back to their childhood, adolescence, their identity, their opinion about their problems, their opinion about themselves, and their opinion about others' opinion about them when it comes to performance anxiety in specific. And we try to understand the person, and when we see the person, we will not be seeing the person with problems. We will be seeing that person and the problem in that person being two separate entities, and we address on those specific things and resolve those things, and thereby give them tips, techniques and strategies to come out of their problem situation. Now I will give you the answer holistically, right? Self-help books, like you mentioned, success, yes you have. Motivation, yes you have self-help books for motivation too. Relationship, yes you have a lot. There are Instagram reels that talk about self-help and how to stay mentally healthy and things like that. But when it comes to the therapy as a process, it is more scientific, evidence based, and it is focused towards an individual with a problem and not as a collective sample as a whole. Like, we will not be using the protocol like, okay fine, you are having performance anxiety, okay fine, I will give you tips and tactics about how to stay positive in a situation, how to handle your anxiety, how to relax yourself, how to prepare yourself better so that your performance will be better. When it comes to people with relationship, yes, there are books that will be talking about how you need to communicate about your love towards the other person, how to express your love, what is the importance of love, and what is the importance of different aspects of relationship and how to work on those things. But when it comes to the therapist, the way the therapist, I have already mentioned about it, the way we address those situations will be entirely different from how the self-help books will help you. With that being said, I hope I have answered the question. Read your self-help books, it will be helping you, no doubt about it, but talking to a therapist is a complete different experience, and it will be an investment for you. It will not be a waste of time or money for you, it will be rather an investment of time and money, because as I always end my speeches, there is no health without positive mental health. Thank you.